and have your eyes done over there. So I've been screwing around for 30 days, and the thing's good for 90, so the VA is paying to have it sourced out. So it sort of makes me feel good, but they said that they're so backlogged.
Yeah, that's always the case. Well, like I was diagnosed in November 2 years ago with prostate cancer.
Well, I had mine taken out.
How when they diagnosed you, how soon before they operated?
They wanted to operate right away, and the doctor I had, this is back, Dr. Davis was here. I forget his first name, but it was Davis from UNM and Davis from here. I got mine, they got mine in November of 2007. That was mine too. They operated February 25th of 2008. And
that's still too long. But it didn't spread. They got it.
Well, no. See, they thought my PSA was only 2.5. And the Gleason score is only 6, so they thought,
But the Gleason, anything over 5 means
high
potential spreading.
Yeah, well, so when they inked the biopsy, the cancer had gotten to the outside.
Free. And they see your appointments. They see you free.
I don't have one now. Well, what I got now is they told me if it's still swelling up, then bring it in.
But you probably got to go through the ER, right?
No.
They'll see you?
I didn't stand up for 6 hours. Last time I went to the ER, I stayed there 7 hours. And I never got in. There was guys ahead of me that were there 2 hours before me. I wasn't going to wait anymore.
7 hours you waited. And they didn't see you. And you think they're treating you all right?
Well, I had a bee sting.
Yeah, but so what?
But they told me to come in if it don't go away. I went in. They told me you got to go to the ER. I said, you go to the ER, I'll never get home. Well, there's no way out. There was nobody else there. I went up there and...
For 7 hours?
There were guys that were there 2 hours longer than I was.
So,
look,
I don't care if he's a good man or not. We're at war.
With them, count with that.
And you expect me to, or anybody to, consent to an operation from somebody who wants to kill me? And he wasn't Islamic. I asked him, by the way. See, some Arabs have changed to Christianity. For example, a lot in Lebanon.
They are, but they're not.
They're not too. I know. It's always love to talk to wise people. But anyhow, I got him out of there. They sent him back because I wrote letters. I wrote letters to the hospital, a general. I called a general, a very high-ranking general who was over this hospital, because the New Mexico facility is really still under military control. It's a VA center, but it's also a military hospital. So they got rid of the guy. And then I would walked in after they got rid of him. Several doctors who knew who I was. They took me in a room, patted me, thanks. We didn't like him here either. And they said he was incompetent.
There's a lot of them here that are incompetent. Like I come in, my husband had a bad night. And it's like I told him, it's like playing a chess game. I go, if you guys know I'm at home, I get a phone call. I'd be waiting till I leave.
Yeah.
If you're going to do this, you're going to do that, but you're not going to do anything.
But I was when I first came out of the Marine Corps, wasn't with the VA. I had enough money, I made good money, and so medical insurance. There's a lot of civilian doctors. Follow them because I live here.
And you know as well as I know, they've even said it that the whites are getting together now in these groups, white supremacists or whatever. It's kind of like the KKK. They're getting back together, and they're gonna wind up doing something.
Is that what you hear? It's happening in Mississippi?
It's just all across the country, in different places.
Well, there's a lot of militant groups there,
right?
All over. I lived in Florida a while, and I wrote a book called Lead, Follow, and Get the Hell Out of the Way. So I had all these, militant groups coming to see me and everything. I'm not interested. They're splintered. They're not. There's no cohesiveness between any of them. Anything they do.
Let's see, just like we got a black president. I mean, our ancestors, World War II veterans, would be turning over in their grave.
Yeah, no,
because they didn't fight for them. I'm sorry.
I know.
They did not. They were fighting for this country, trying to come out of a depression.
They never caused any problems.
Oh no, this is we can't say everybody's like that. But this is the fraction that we do.
What do you have, like one a day during the week or something?
Actually, I get to the point where I get like 5 or 6 a day if they really. Depending on it's seasonal. During the summertime, it kind of calms down. Wintertime, it calms down. It's either too hot, too cold for anybody to commit a crime. But same civilian world, it doesn't, just because you're a veteran or civilian doesn't mean that you're capable of doing
I mean, you would think that they could lose their benefits, so they'd be careful.
You can, but in the past, we had security in the VA, so you can get away with anything and just walk off.
I'm absolutely amazed at what you're telling me. Because I go to the New Mexico, although I'm in Arizona, it's much closer to the Albuquerque than going to Phoenix.
But yeah, you talk.
And I've never seen her. I've been in the hospital there half a dozen times. Stayed, never seen or heard any incidents.
Oh yeah, but if you talk to the police, you get to hear the dirty underside.
You just probably quell them down rapidly,
we
right?
try to. Oh yeah. And then we take them to county or El Reno's, our federal prison. So.
Do you wait till they commit a crime, or you?
Oh yeah, same thing's out in town. You actually got to do something wrong before we can transport you right there.
Really, I'm amazed. I really am amazed because, like I say, I've been in the Veterans Benefits offices. Let's see what this says. Veterans Benefits office, is it still open even?
Cancer? No, not for cancer, but because I can't pee good.
Yeah, but that's the early signs of,
Right, so they give me a pill so I can pee good.
Well, you know what they're finding now, and I did a lot of research on this 2 years ago. They're finding in any areas that swell, and what causes before you have prostate cancer, is a swelling down in it. That's what stops the restriction of peeing and everything.
Yeah.
Any areas that swell in that area eventually end up with cancer.
Okay. Well, my brother had it, so I look forward to it. Thank you. I appreciate that.
But listen to me, honestly, listen to me for a second.
Mm-hmm.
When you go in and they diagnose you with you say, I want it removed right away. If they say it's 3-4 months, go to a senator or congressman or something and say, hey, you got cancer, and they say you have cancer, don't give me this BS.
The longer it stays there, the worse it gets.
That's right. See, they waited 3 months with me. 3 months before they pulled it out, and it had spread already.
Yeah.
But when they get the prostate cancer early, and they remove your prostate, it's called radical prostatectomy, your chance of survival is like 95%. If they wait, every day it goes down, see? And they make the excuse like, oh, there's no beds available, or send me another hospital. Oh, we can't do this, not in the budget, We didn't steal
we
enough
gotta
from
get
this
going
guy.
because this traffic right now is it's getting to be the worst time. We're on bikes.
Oh, are you? Good. Yeah, come about 5 minutes.
How may I help you?
I don't know where I should go. I tried calling, and that was ridiculous.
For what, sir?
I want to change my, everybody in the military has a life insurance policy. I want to change my beneficiary.
Okay. You need to check with enrollment.
Check.
Right there.
My fellow Americans, what you've just seen is what your health system is going to become. I had to condense everything, and I'm going to even do this very fast because I had like 10 hours and I had to get it in there. And the complaints and the things you see there are real. They're from actual VA veterans or wives of veterans or family members, and they're actually from 7 different VA locations all across the country. And play it again, and have everybody else play it again. Get as many people as you can, because that's what your medical system is going to become. And it's not the doctors and nurses. I said that in the beginning. I want you to understand that. It's the system. When the system gets so large, like, I had cancer, they should operate, they can't wait, there's no time. 3 months later, cancer spread, they operated, and it was futile. Many cases like that. Listen to them all. One of the things that's not clear in there is the lady that's a 61-year-old lady, her husband's dying of Lou Gehrig's disease. Well, they didn't know how to diagnose it. She had to get an attorney to force the VA to cover it. She got a private attorney. Her thing is like 2 hours testimony, so I had